Please allow us to introduce you to the MiNDAUS Registry, which is a once-in-a-generation initiative developed by the MiNDAUS Partnership. The MiNDAUS Partnership is a broad representation of experts, patients, carers, support organisations and researchers from across Australia who believe that patients belong at the centre of their care. This partnership builds on years of experience, research and innovation. Many of the people and organisations involved have worked together in the past, and our motivation was and is to improve the treatment and support of people living with motor neuron disease and make taking part in research more simple. Our ultimate goal is to promote the search for a cure. Controlling and sharing our healthcare information is something we all need to do. These details are often in different places and are not always easy to access. Some of these details are basic and change rarely, like a Medicare number. Other information changes more often, like our symptoms, medicines we use, or treatments that we start or finish. Living with MND creates a need to share our health information across different healthcare providers when we see them. Ideally, these health details need to be current and readily accessible at the time of this clinical contact. The ease with which this information can be kept up to date and shared is critical and amplified for people who have communication challenges. The ability to provide accurate history and current details at the time we see a healthcare professional enhances our ability to be effective partners in managing our health. The way we are able to store and share our information is critical to improve the accuracy of communication and reduce the need for repetition and recreation. The MiNDAUS Registry has been designed with this in mind to aid the delivery of effective and timely healthcare. This registry has been created with the highest standard of security possible and offers patients and carers a highly secure online place where the information that rarely changes can be stored alongside information that changes more often. Patients and/or their carers can update and share information from simple preferences to details of their most comfortable position and how much assistance is needed for daily activities. For instance, I need extra pillows, I can't lay flat, I need my fluids thickened, or I need head support. Specific information can be updated as often as necessary, such as starting a new medicine or a change in ability, and then can be shared directly with a new paid carer, hospital or clinic staff, or extended family or friends. Patients can also record recent symptoms and compare them with previously recorded symptoms to keep track of changes and the effects of treatment. Patients also have the option to complete specific questionnaires such as the ALS Functional Rating Scale. The MiNDAUS Registry allows a patient to agree to have their clinical information, including their medical history, reflexes, current weight and breathing tests, for example, all collected when they see their MND specialist. The patient and their carer, their healthcare team and researchers can all benefit from this association of information that's entered by the patient and the information that's entered by the specialist. Firstly, patients can see the information collected about them at each specialist visit. Secondly, the team at the specialist clinic can see the most up-to-date details the patient has recorded about themselves. This transparency will improve communication between the patient and their healthcare team, which often involves a hospital team, community-based professionals and teams, and support organisation staff such as MND Association advisors. When we collect clinical information regularly, it contributes to our understanding of the way MND is progressing in an individual. When this information is collected about many people, we can start to understand the full picture of MND in Australia. For instance, how many people with MND live in rural areas? How many people with MND are supported by the NDIS? And how many are in the aged care system? The ability to answer these questions and others, and use the answers to improve services and care, is an important goal for us, which we're committed to delivering into the future. We also know that many people with MND want to contribute to the search for effective treatments and an ultimate cure. Until the development of the MiNDAUS Registry, there has been no simple national way for everyone to contribute. Under strict conditions and procedures which ensure privacy, this is now possible. Using the MiNDAUS Registry, the patient has control and can agree to contribute to this collected data, participate in current projects, and be considered for future ethically approved research. This work has been supported by the Australian Government National Health and Medical Research Council, the MND Association of Australia, MND Research Australia, the MND Association of Western Australia, the MND and Me Foundation, the Racing for Mindy Foundation, and the Thomas MND Research Group of South Australia. The MiNDAUS Registry also builds on the Australian Motor Neuron Disease Registry, which holds the precious information from 2,500 patients and which will be analysed in conjunction with the MiNDAUS Registry. On your screen now, you can see the names of our collaborating institutions. You can find out more on our website, register yourself, and take advantage of this resource and encourage others to do the same. We gratefully acknowledge the continuing involvement, inspiration, and advice from people with motor neuron disease and their carers and the healthcare professionals that support them. Thank you.